Yes.
Good afternoon, everyone. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 News Conference. I'm Nancy Hullett, and I'm with the Department of Health and Community Services. I'm the moderator for today's question and answer session. Joining us today is the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Haggie, Minister of Health and Community Services, the Honourable Siobhan Cody, President of Treasury Board Secretariat, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, December 17th. We're here today to share some updates on a few different things, namely the booster schedule for COVID-19 vaccinations, the success of our mandatory vaccination policy and regulation, and adjustments to public health restrictions to combat the growing risk of the Omicron variant. To be clear, Newfoundland and Labrador, this is not a lockdown. We appreciate how hard everyone has worked to get vaccinated, to use the NL Vax Pass, and your continued vigilance with following public health guidance and orders, wearing your masks, keeping your distance, and washing your hands. We all know how effective it is, and we all know that we are ready to pivot, as we have in the past, in the fight against COVID-19. Right now, with the new variant, we have to pivot again. I know we're exhausted. We want COVID-19 to go away, believe me, I do. But we are resilient Newfoundlanders and Labradorians, and we will face this battle, as we have in the past, together. Please keep in mind that our incredibly high and enviable vaccination rates are a big help in this fight. And I'm proud to say that almost 100% of government employees are fully vaccinated in compliance with our mandatory vaccination policy. And we're very close to 100% with school staff and health authority employees as well. Thank you, Newfoundland and Labrador, for doing your part, not just to protect yourselves, but to protect your loved ones and your communities. Now we must keep it up. Bearing in mind how dynamic things are in the pandemic, we are once again adjusting the timelines for booster doses. Everyone over the age of 18 can get a booster dose 22 weeks after their COVID-19 vaccine. This is, in my estimation, the sweet spot. At the 6-month threshold, almost 95,000 people were eligible for the booster this month, with more than 170,000 in January. Moving to the 22-week mark, almost 265,000 Newfoundlanders and Labradorians will be eligible for their booster by the end of this month. And a booster is a key in the part of strengthening our arsenal against this severity and spread of Omicron. Please be patient. Please be kind as we continue to receive and distribute vaccines. I spoke with the president of the Pharmacy Association this morning, and we discussed supply chain logistics and communications, and we'll endeavor to continue to work together to ensure that they are getting what they need to help you. It's so great to hear that so many of you are being proactive and making sure that you can get your booster when possible. In the coming days, we will be amping up mass vaccination clinics to help meet that demand. Thanks to all the healthcare professionals and workers across the province. Your grit, your determination, and your work ethic, and caring, kind, compassionate, are unbelievable and continue to be an inspiration to us all. We rely on you so heavily, so please know how valued you are by all of us. In terms of our tools to continue to fight this new variant, adjusting public health restrictions on the size of gatherings is one of the best. Believe me, this isn't where we want to be. I don't want to be delivering this news. Dr. Fitzgerald doesn't want to be delivering this news. It's not the news we want to be sharing. But it is important to ensure that we can all have a safe holiday season and keep Newfoundlanders and Labradorians out of hospitals, out of the ICU, as this variant inevitably spreads. Please, stay vigilant. Reduce your own numbers. One of the most important things to remember right now is to be calm, to focus on taking care of yourself, your mental health, and looking after your loved ones. Newfoundland and Labrador, we are going to be okay. With that, I'll turn things over now to Minister Cody and President of the Treasury Board to share more about the mandatory vaccine policy and the impacts it's had. Minister?
Thank you very much, Premier Fury. As we all know, COVID-19 is still within our province and creating difficulties and hardships for our families and our communities. Back in October, the government of Newfoundland and Labrador announced a mandatory vaccination policy which applies to public service employees in core government departments as well as in agencies, boards, and commissions. The policy was implemented in an effort to ensure continued safety in the workplace, as well as to ensure additional health protection for Newfoundlanders and Labradorians. Today, the policy comes into effect, and I'm pleased to see almost all public service employees within our core government, as well as in agencies, boards, and commissions, are compliant with the policy. As of today's numbers, over 99% of core public service, indeed it's 99.4% as of this hour, of employees are compliant. And in some of the agencies, boards, and commissions, for example, in the school staff, it's about 98%. In healthcare, it's about 97%. So tremendous effort on behalf of all of our employees. They've done their best to help limit the spread of COVID-19 in the workplace and in our province. I think that everyone understands that vaccines work and that we're here to protect each other. And so I thank public service employees for ensuring their compliance with the policy, but more importantly, ensuring that they are protecting themselves, their family, their friends, their communities. Thank you.
Well, thank you, Minister. I now invite Dr. Fitzgerald for some comments. Dr. Fitzgerald?
Thank you, Premier. Thanks, everyone, for joining us today. Since the last media advisory, we have 46 new confirmed cases of COVID-19 in our province. 11 of these are in Eastern Health, 8 are related to travel, and 2 are contacts of cases. 1 is under investigation. 4 are in Central Health, and all are under investigation at this time. 31 are in Western Health. 20 of these are contacts of cases, and 11 are under investigation. There have been 4 new recoveries, 3 in Eastern Health and 1 in Western Health, leaving 76 active cases in the province. The total number of COVID-19 cases for our province is 2,152. No one is hospitalized as a result of COVID-19. 1,707 tests were completed since yesterday, for a total of 357,188 to date. While most of the cases being reported today are Delta, we have also detected more Omicron cases. Based on the experience of other jurisdictions, we expect that our case counts will continue to rise rapidly in the days to come, particularly with 2 variants circulating at the same time. We have a very careful balancing act ahead of us. We are cognizant that there have been many people and businesses impacted by COVID-19 restrictions over the last 2 years. We want to allow society to continue to function to the greatest extent possible, particularly during the holiday season. Our goal is therefore to keep the spread at a manageable level to prevent our healthcare resources from becoming overwhelmed. We are not in the same place we were in the first 2 waves of COVID-19. We have the benefit of a high vaccinated population this time around. But we need several layers of protection against this variant, and vaccinations alone are not enough. While it appears that the vaccinations continue to do well in protecting individuals from severe illness, they offer less protection against acquiring and transmitting COVID-19, especially with Omicron. We have developed a plan to adjust restrictions based on a number of indicators, including the epidemiology in our province and elsewhere in Canada, increasing test positivity rates, evidence of community transmission, characteristics of the circulating variant, the number of hospitalizations and ICU admissions, and public health capacity to respond. Based on where we are today, we are introducing new restrictions in an effort to mitigate the growth in new cases. First, we're making changes to our guidance for case and contact management. Anyone that has been identified as a high-risk contact of a case and who is fully vaccinated will now have to isolate for 7 days. I realize this is a strong measure, and we don't intend for this to be a permanent change to our COVID-19 case and contact management guidance. It's a temporary measure, recognizing that we are in the very early stages of dealing with the Omicron variant. When we are confident that we are in a better place, we will revert back to our regular guidance for case and contact management. We did similar with the Alpha outbreak earlier in the winter. In the weeks ahead, I expect that we will have many individuals potentially exposed to COVID-19 and wondering what their requirements are. We have a self-isolation guidance tool available on our website to help people navigate those requirements. Please only call 811 if you are ill and need advice from a nurse, or you do not have access to the internet and need assistance with completing the online self-referral tool for testing. Secondly, effective midnight tonight, out-of-region individual and group travel for amateur sport, art, and recreation activities, such as competitions and training camps, is not permitted. Tournaments are also not permitted. Teams can continue to play within their geographic region as they would during the season. What we want to avoid here, teams traveling outside of the usual area or any one-off events that bring many groups together or groups from different regions of the province together. We are also making changes for businesses and gatherings that will take effect Monday, December 20th at 12:01 a.m. Weddings and funerals, burials, religious and cultural ceremonies are now limited to 50% venue capacity where VaxPass is in place and 25% where VaxPass is not in place. Spectators and attendees at fitness facilities, arenas, performance spaces, cinemas, and bingo halls are limited to 50% venue capacity. Bars and lounges are limited to 50% capacity with physical distancing. Restaurants are limited to 75% capacity with physical distancing. We are also encouraging people to work from home where possible. There are no changes to informal gatherings, such as those in a home. These remain limited to a maximum of 25 people at this time. We have maintained that schools should be the last to close for the well-being of children and youth. Students in the K-12 school system have about 3 days left before the Christmas break. We are hoping they can complete the term. If things should change drastically over the weekend or in the weeks that follow, we can't rule out an extended break. This is a rapidly evolving situation, and restrictions may change with little notice. We all need to be prepared to adapt if that happens. Finally, as the Premier announced, our province will be reducing the required interval for booster doses to 22 weeks. This applies to everyone over the age of 18. We are expecting a large influx of vaccine supply this week, and appointments will open up as soon as these are distributed to clinics, pharmacies, physicians, and nurse practitioners. Please be patient while staff work to ensure distribution of the vaccine. While boosters are available to all those over 18, Public Health is strongly recommending boosters for those aged 50 and older, and especially those 70 plus. Those living in long-term care homes for seniors or other congregate living settings that provide care for seniors. Those who received a viral vector vaccine series completed only with viral vector vaccines. So that would be 2 AstraZeneca or Covishield or 1 Janssen. The adults in Indigenous communities or who identify as Indigenous. Frontline healthcare workers having direct in-person contact with patients, and those who travel regularly out of the province to work. As we approach the 2-year anniversary with COVID, I know there is pandemic fatigue. But wishing COVID away will not make it so. We have the opportunity to swing the pendulum in our favor. Another wave is coming, and we need to batten down the hatches once again. In the spirit of the holiday season, we need to summon all of our kindness, compassion, and perseverance. Although some days it seems like this pandemic is endless, we will eventually get to the other side. What is important right now is that we support one another to find the mental and emotional strength to get through this and to stay safe. whole staff of Newfoundland and Labrador. Please take care.
Well, thank you, Dr. Fitzgerald. I'll now invite some brief comments from Minister Haggie.
Thank you very much, Premier. I think these last few days have highlighted that truly the only constant feature of COVID-19 is the need to change, and sometimes to change rapidly. We have identified 19,969 RHA employees. As of noon today, we know of 75 that will not be taking the vaccine, and another 91 who are currently partially vaccinated, who will, in the fullness of time, obviously, be able to resume their work once they've had their second shot and or done their 2 weeks. I'd like to take an opportunity here to talk a little bit about vaccines. Pharmacies have been an integral part of the delivery of Moderna and also the flu shots again this year, and they've done a grand job with both. We are aware of 18,000 or thereabout doses of vaccine that are out in pharmacies, although I think there is a challenge with matching up supply and demand, which we're working on. Certainly, as the Premier referenced, we're meeting with them on a regular basis, and we expect some significant influx of vaccine from the federal supply in the next couple of days. Our supply chain is ready to deal with that and is ready to take whatever the feds can fill us up with. As far as these outbreaks are concerned, we have tools in our toolbox. There are expectations of rapid tests arriving in the next few days to manage travellers to the province. And then as further supplies come, these will be distributed, and that will be made clear, and that plan rolled out over the course of the next few days. The boosters that have been referenced, a shortening of the interval, enables more people to qualify for their third shot. And new appointments, as Dr. Fitzgerald has referenced, will be added as soon as probably this broadcast ends, in actual fact, in some cases. But our tried and true have been public health measures. They, along with the other tools, have been, as Dr. Fitzgerald referenced, a defense in depth against COVID. So again, we've had to tighten up some of those restrictions, conscious of the time of the year and conscious of the fact that we have stellar vaccination rates compared with any place on the globe, for which I thank each and every one of you. So with that, Premier, I don't think there's much more for me to add, except to, if we don't go to air again, to wish everyone a happy holidays, a Merry Christmas, if that's your tradition, and take care. Thank you.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. Today we have 1 journalist in person and 5 joining by phone. The first round of questions and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with the CBC. Peter, please go ahead and make your way to the mic.
Thank you. Minister Haggie, I'm wondering, you were talking about the numbers in the healthcare system. There are about, I guess, 150 or so people who are not going to be able to show up to work. Do you expect any impact on the healthcare services that are able to be delivered, or can the healthcare system handle it? And for Minister Cody, for core civil service, do you expect any impact of the folks that are not vaccinated?
From the health perspective, this is the whole gamut, the whole range of healthcare providers and support staff. Some of the groups are so small that it probably would be a privacy breach to actually list them by job titles. So that's why they've been aggregated, simply because the numbers are so small in any individual category. Because of that relatively small group size, less than 3 or 5 in some cases, the RHAs are not advising me of any disruption to service levels beyond what we're providing currently.
Thank you. On the core public service, there are 32 that are currently non-compliant, and they would be now home absent without pay. And I will say that we're not expecting any service delivery challenges due to this.
And Premier and Dr. Fitzgerald, I'm wondering if you could both answer this question. You know, you touched on COVID fatigue. There are a lot of people who feel like they stepped up, they got their 2 shots, they were promised things were going to get better, and now they're getting worse. What's your message for people who are just fed up and feel like they can't handle more restrictions, especially going into a Christmas that they've been looking forward to?
Sure. First of all, I'd say that their efforts are largely why we're in such a good position right now. We're very different than a lot of other jurisdictions around the world when you look at the UK and their vaccination rates compared to ours. And this is life with COVID-19. We're not going into full lockdown. That is partially because of the benefit of the vaccines. We've seen Delta in the province. It hasn't ripped through this province like it has in other jurisdictions, and that's because people have stepped up. They've done their part. We've had a very different summer here than a lot of other jurisdictions around the country, including some of our, cousins and family and friends around the country. All of that is because we have followed the public health guidelines. We have done the vaccines and gotten the vaccines, and people have done their part. This is still early days with this new variant, and we're hopeful that the science will evolve to the point where we know more about the severity of the illness, the hospitalizations and the ICU capacity and occupancy, which I think is the true metric that we all need to be following with respect to this particular variant. But we're taking these measures now because it is too early to know what impacts it will have, and once we do know some of the impacts, it may be too late. So hopefully all of these measures are short-lived, but we feel like this is the important thing to do right now. Go ahead, Dr. Fitzgerald, sorry.
Thanks, Premier. Yeah, and I would say, reiterate a lot of those comments. I think we understand that people are tired, and the timing just sucks. There's no other way to say it. But we are in a good place, and with these measures, I think we can be in a good place again. We're going to have a few, less than ideal weeks, I think, but I think we will be able to get to a good place again. So I want to reinforce that people's labors are not in vain. All of this work that you've done, stepping up to get the vaccine, it's not in vain. It really has made a difference to where we are. And, we will get through this like we've gotten through everything else. And once we have more information about this Omicron variant, I think, that part of this is because it is spreading so quickly. We just haven't had the time to get the information that we need. And I think, with other variants, we did have a little bit more lead time to be able to get that information and know how to deal with it a little bit better. But we're learning, and we're learning more and more every day. So as Premier said, these measures will hopefully be temporary, and we'll be able to move past this hurdle as well.
Our next questions are from Peter Jackson with The Telegram. Peter, please go ahead.
Good afternoon. Happy Friday. I'm wondering if there was any thought at all of shutting down schools early, just closing the doors and not opening them again on Monday.
Well, I'll get Dr. Fitzgerald to weigh in a second, but our primary objective was always to follow public health advice and to follow Dr. Fitzgerald and her team, who have led us through this with respect to schools in the past. And I know that, Dr. Fitzgerald, do you want to take instead of me speaking for you? Go ahead.
Thanks. So, at the moment, public health, there are schools that are affected. There's no doubt about that. And those schools are being managed by public health in conjunction with the school district. And if, at this point, those that are not affected, we don't have evidence that we need to close these at this time. It's very important for children to try to stay in school as much as possible. That's been our goal since the start of this school year, and it will continue to be our goal. We want schools to be the last to close and the first to open because it's so important for children to be in school. And we also have to remember that there are vaccine clinics going on next week in schools as well. And so we want to make sure that every child can get the opportunity to get a vaccine before Christmas. So These are important considerations. But as I said, if things change drastically and it's prudent to close schools, we will make that recommendation.
Okay, thank you. And can you clarify again? You talked about changes in capacity for restaurants, clubs, that sort of thing. Are there any changes to the maximum numbers in gatherings?
Dr. Fitzgerald, you're on mute, I think.
Sorry. You think after 2 years of Zoom calls, I'd have that figured out.
It's usually in person.
Yeah. So at this point, we're really talking about capacities of buildings as opposed to numbers of people in a gathering, and that's to allow, partly to allow for physical distancing as well, which we know when we have masking combined with physical distancing that certainly helps to reduce the risk even further. So the main reason right now is just to try to reduce the number of people and to allow for physical distancing. So we didn't put an actual limit on the gatherings, more so just on the capacity of the buildings, or the venues, sorry.
Thank you.
Our next questions are from Ronelle Legros, all Newfoundland, Labrador. Ronelle, please go ahead. You mentioned that there would be some vaccine arriving in the province this week or next, a large supply of vaccine. Wondering if that includes any of the rapid tests, and if you have any more of an update on how the province might be able to use those rapid tests.
Well, we'll throw it over to the minister, but the vaccines are on the supply chain has been accelerated. The supply has been accelerated and will be accelerated to meet the changing interval scheme in particular. The rapid tests are, if they're not here now, they'll be here tomorrow, as I understand it. But Minister, perhaps you have more details that you'd like to share?
Well, the rapid test, if not here today, will be here tomorrow. That's the information we have from the Fed. The vaccine issue, quite frankly, our supply chain is ready, and the challenge has been expediting some of the deliveries from the federal agencies and just simply bringing them forward. So we've got one lot kind of in and another lot coming. We anticipate, we haven't confirmed yet, sometime in the next couple of days. We're waiting for, if you like, a shipping advice from the national inventory. And as of coming to this briefing, that had not been received yet from the Fed.
And perhaps for the Premier, I'm just wondering if you've had any further conversation with the federal government, any other plans there? Do you anticipate any further travel restrictions in the coming days, or any other restrictions for that matter?
I haven't had any conversations around travel restrictions. I have chatted with Minister LeBlanc regarding the acceleration of the vaccine supply, given our change in the interval, and of course the rapid tests. And he assures me that they are there to support us and are working diligently to ensure that we get that supply. There hasn't been any talk to date on further travel restrictions. No.
Our next questions are from Noah Shepard with VOCM. Please go ahead.
Thank you. This is a question for Dr. Fitzgerald. Do we have the exact number breakdown of Omicron cases versus Delta cases?
So at the moment, our presumptive number of Omicron, we only have presumptive numbers of Omicron cases, so they have to be sent off to the lab to be confirmed. However, we do expect that they will be confirmed at the lab. And some of the information was actually just came in as I was sitting down to join this call. So I don't have the latest information, Noah, but we can certainly get that for you.
Thank you. As well, public health saying anyone who got their second dose now with that interval changed, but some other provinces like Saskatchewan have their interval at as low as 3 months. Is there any justification why we're waiting a little bit longer than some of those jurisdictions?
We're
Well,
balanced.
we certainly know. Sorry.
You go ahead, Dr. Fitzgerald. Yeah.
Okay. We certainly know that a longer interval between doses it does give a higher or a more robust response from the vaccine. So we want, and that can translate into a longer term protection. So we want to make sure we're getting the longest term protection that we can, because Omicron will be with us for a while, and so we need to make sure that we can keep that vaccine protection with the booster up as long as we can. Some areas of the country, have a very different epidemiology than we do right now, and so they're making decisions based on their local context, and as we do ours. So I don't think you really can compare. I think you're comparing apples to apples because it's not necessarily the case.
And no, that's why we said that this was a bit of a sweet spot for us right now. Will that change? Potentially. But right now, just shifting that small frame shift will allow an additional 170,000 Newfoundlanders and Labradorians to get vaccinated by the end of the year, while still protecting a fairly large interval between second and third dose to create that immunological response that's required that Dr. Fitzgerald was speaking of. So we are a bit different than other jurisdictions, both in the epidemiology and the rate of uptake from vaccines as well. So that all speaks to the sacrifice that Newfoundlanders and Labradorians have made along the way.
Thank you.
Our next questions are from Ben Cleary with NTV. Ben, please go ahead.
Hi, and thank you. When it comes to boosters, what do you say to people who are hesitant about getting the Moderna booster, maybe because it doesn't match their previous vaccines? Say if somebody got AstraZeneca to start, then they got Pfizer, and now they're being told that they can get Moderna.
So to date, there's been.
Sorry, go ahead, Dr. Fitzgerald.
Yep. To date, there's been no evidence to say that having different vaccines is reducing the effectiveness of the mRNA vaccine. So certainly we know that boosting with either mRNA vaccine is actually quite effective, and Moderna is just as effective as Pfizer, and so there is absolutely no reason that people shouldn't take Moderna unless they were allergic to some of the ingredients in it. But for anyone who doesn't have a contraindication in that regard, there is no reason not to take Moderna. It is a safe and effective, very effective vaccine, and provides a very good immune boost when used as a booster dose.
Thank you. And my second question is, can you walk me through again the restrictions that are coming to sports over the holiday season, and how big of a concern is regional travel over the break?
That was a line from 2021. You're on mute.
Sorry, that's twice. Third time out, right?
That's a freeze frame.
So, effective midnight tonight, out of region, individual and group travel for amateur sports, arts, and recreation activities, such as competitions or training camps, is not permitted, and tournaments are also not permitted. So we're saying that team play can continue at the moment within your region, or within the teams that you normally would play. Our goal here is just simply to reduce the number of people coming together in one place at one time, and to reduce that amount of spread. I mean, we have seen some spread through sporting events. We've seen some spread through other things as well. But when people are playing sports, they tend not to have masks on, so that increases the risk again. So we know that this variant spreads very quickly. It seems to have a shorter incubation period than other variants, and so sometimes, before we even find out about the first case, we've got a second or sometimes third generation of spread. So that's why it's so important for us to try to reduce our contacts and to prevent that spread to start with. And so these measures really are just in an effort to try to reduce that level of contact on a population scale.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, my first question is just a clarification. You're saying no outside of region travel, but just how do you define region?
Most of the sports have their own regional breakdowns, and so that's what we're using for, we're advising for use of that. That's what we've used before when we've done this. So it's basically whatever the sporting region is, and I think discussions have happened to clarify that with sporting organizations.
Okay, and related to booster shots, again, if you go online today, I'm on the Eastern Health portal right now. It's possible to book a booster shot in the St. John's area. Given the importance of that third shot, when is that going to change? When is it going to be easier to start booking that third vaccine, given, like you say, the importance of having your third shot?
By later on today.
Yeah, Patrick, we're working to amp up, as we said in the introductory remarks, back to where we were over the summer. That takes a little bit of time. We're hopeful that there will be increased capacity at the mass vaccination clinics, certainly within the next 48 hours or so. And as we reassemble that team that did such an incredible job over the summer, the dedicated healthcare professionals that just knocked it out of the park. But it shouldn't take us long.
I will now go back through each reporter to see if you have one final question. Peter Cowan of the CBC, do you have a final question?
I do. When we look at rapid tests, we're going to be using them at the border, but does the rising number of cases and the expectation that we're going to see more cases over the holidays change the plan to not distribute these within the community for people who may want to be able to use them before gatherings over the holidays, for example?
That's probably best for Dr. Fitzgerald.
So our plans at the moment, we're certainly looking at all options and of how to use these tests, and so some of that, those discussions are going on right now. We do have quite a number of tests coming in the near future, so we certainly will look at how best to use those. We want to start using them, there are some discussions about using them for outbreaks, as well as using them when we're seeing community transmission, and perhaps with regard, once school starts again, with regard to children not in school, but for children to be tested when they have symptoms. So, there are lots of options for us to be able to use these tests, and we're certainly looking into all of them to see what's the best way to use them for us. And we'll have more information about that in the coming days.
Peter Jackson with the Telegram, do you have a final question?
Yes, I do. I just want to say I feel kind of vindicated when it comes to the mute button.
Well done, well done. You should also feel vindicated for the best joke of the year.
Can you explain what holidays we can expect for shots over Christmas? Will they be given, for example, on Boxing Day?
Minister, that's probably best for you, I think.
Yeah, no, it's a good question, Peter. I think, realistically speaking, that is very much an RHA operational issue, and it may vary from region to region. I think a lot of staff have worked extremely hard delivering vaccines, and I think some of them had kind of pinned their hopes on a family holiday, just like we all have. So I don't know what the art of the doable there is from a staffing point of view. I do know that we will have a plentiful vaccine for the days before and the days immediately after. But it may well be that some RHAs are able to run clinics on Boxing Day, and it may well be that others are not.
Thank you.
Ronelle Legros, All Newfoundland Labrador, do you have a final question?
Yeah, Dr. Fitzgerald mentioned that the presumptive cases of Omicron have now gone to a lab for confirmation. I'm just wondering if any of those cases have appeared outside the Eastern Health Region, if any of the presumptive cases are within another health authority region.
So at the moment, we do have Omicron in Eastern, and we have a confirmed Omicron in Eastern, and the presumptive Omicron, there are more in Eastern and as well some in Central Health.
Noah Shepard of the OCM, do you have a final question?
I do. Last year we saw a surge in cases following Christmas and the holidays, and with the highly transmissible nature of Omicron and restrictions a little looser this year than they were last year, are you worried or do you anticipate another spike in cases following the holidays?
I think that's
I think we're going to see increases in cases over the next several days, and probably through the holidays, and a little after the holidays for sure. But we know what we have to do to keep this under control. We can practice all of those tried and true measures. Keep your distance, wear your mask, wash your hands, and stay home if you're sick and get tested. That's really, really important. Keep your contacts as low as you can. We will see more cases, and I think we're going to see a bit of a trend of higher than what we usually see in cases for a little while. But as I say, with these measures that we've instituted, and with people following those personal public health measures that have served us so well up to now, I think we can keep things in check.
Ben Cleary with NTV, do you have a final question?
I do. What's your message to parents now going into school on Monday and Tuesday, Wednesday? What's your message to parents who might be concerned about sending their kids to the classroom?
So I think if public health feels that it's safe to have a school open, then it's safe to be open. Public health is not going to recommend keeping a school open or a classroom open if it's not, if there's a risk of contracting COVID. So, I think we need to remember that we've all worked really hard, that the children have worked really hard, teachers have worked really hard, and staff as well this year to keep our schools as safe as possible. And it's really important for children to wear their masks, and all those other measures like cohorting and all the cleaning that's being done, the hand sanitizers in the classrooms, all of those things are very important. And we've had those in place up until this time for the last little while, and I think that's part of the reason that our schools have fared a little bit better up to now. So I think we want to keep schools open. We know the importance of schools to the overall well-being of children. So I think we can feel reassured about going back to school on Monday.
Thank you.
Patrick Butler with Radio Canada, do you have a final question?
Hi, yeah, one final question. New Brunswick just announced 163 new cases. Nova Scotia today, 394. Is that where we're headed? Do you think those huge numbers in Newfoundland and Labrador? And on Wednesday was supposed to be the last briefing before the holidays. Are we going to be seeing more of you, do you think, Dr. Fitzgerald, over the Christmas break?
Well, for your sakes, I hope you don't see more of me. But I think, as I said before, I think if we can do all those things, we've got a bit of a jump on this. We've had a little bit of time to prepare. We've had a little bit of time to think about what we want to do and how we want to respond to this. And unfortunately, New Brunswick was in a situation with Delta before Omicron came, and I think a lot of their cases are still Delta. And Nova Scotia was in a situation where they had a very large gathering that caused a fair bit of spread before anybody knew what was happening. And so that's the thing about Omicron. You need to be speedy, and I think we've been able to find these cases so far quickly, and so I think as long as we can remember to do the things we need to do. I cannot stress enough the importance of staying home if you are sick. The number of people over the past, well, not just recently with these cases, but even over the last 6 to 8 months, the number of people that have continued to go to work or go to school or attend activities and recreational activities when they have had symptoms of respiratory illness is growing, I think. And I understand that everybody is tired, but it really, really is important to stay home and try to keep to yourself as much as you can if you're not feeling well, and to get tested, of course.
Thank you, everyone. Premier Fury, do you have any final comments today?
Yes, thank you all for joining us. I know that for some, this is not the news that you wanted to hear. It's certainly not the news that any of us wanted to deliver, that's for sure. But please continue to do your part. Keep calm, take a deep breath, look after yourself, your mental health. We will get through this, and vaccinations are our number one tool in moving through, and we are incredibly excited and supportive of the effort that has been put forth by healthcare professionals to deliver those vaccines, and equally buoyed by the response from you, the general public, in terms of even trying to book your boosters, and we will ensure that we're getting those as fast as we can moving forward. So thanks. I wish I could say that this will be the last one before Christmas and wish you all a very Merry Christmas, but I'm not sure that that's a reasonable prediction right now. So take care. Have a good day.
Thank you, Premier. Thank you, everyone, for joining us today.